I'm going to give you one last thing because I think you deserve it. And that's a way to improve the dorsiflexion or the movement at the talocrural joint. So that joint that really is right between those two bumps on the outside of your ankles. Let's show you that one real quick.
So one of the most common ways that people will try to work that TC joint or that high portion of the ankle is to really just do a walking stretch or a lunge type stretch to try to get that motion out there. Now, one of the things that ends up happening as we really get into it is we end up losing our weight bearing. So we end up bringing that heel up. So what I found is that if you do a twofer where you're just trying to stretch out a lunge and your hip and you really bear weight through that ankle as you're doing it, you can get that end range and you just try to stay there keeping that heel down. And that's going to work on that mobility there. And then from there, if you have the ability to, add in just a little bit of that rotation, still trying to keep your knee above the middle and second toes. That'll help you out with trying to encourage some of what we were talking about with decreasing that arch height, which on me is just a miserable pain to try to get, especially since I start losing weight bearing out of that outside, which hurts with my balance. And then from there, I can grab on the ankle, do a little bit of bouncing, come out of it, up, rotate a little bit here, a little bit of bouncing just to get more motion out of it as best I can. And then the last trick you can do, sometimes you have some tightness in a muscle that runs right back in here, which is the posterior tibialis. As you get into that end range, just do a little bit of gliding along that tendon. Really try to just get it to feel some of that pressure in there, which will help just loosen things up for you. Try to get that end range flexion for that squat.
All right, so you've seen what I do to try to maintain the mobility as best I can in both my foot and my ankle using these different techniques. And those really seem to help me out with at least maintaining that mobility, given the high arches are really starting to hurt me with my ability to get into that deep squat, especially given that pre-existing injury that I had before. But I'm going to start working on that too, and we'll see what I do for that as I start moving up the chain.